Welcome to the first episode of The World Today. In this episode, our topic is gonna be about HIV. If you happen to be a person who has a negative thought about a person living with HIV, then we hope you would change your mind by the end of the show.
Nowadays, HIV is a manageable long-term condition. This is a virus called HIV. It has one thing on its mind: making more copies of itself, regardless of the damage that it will do to the body. These are CD4 cells, also called helper cells. They are part of the immune system and are the body's defense against attack from unwelcome bacteria and viruses. But when a HIV virus attacks a CD4 cell, it gets inside the cell and starts making copies of itself. Eventually, the CD4 cell dies, releasing more HIV into the body, which in turn attack more CD4 cells. Without additional support, the CD4 cells are quickly overwhelmed by HIV viruses. With CD4 defenses lowered and HIV multiplying, the body becomes vulnerable to attack from other infections. However, there are several treatments available to help CD4 cells fight back. This involves taking a combination of drugs that help the CD4 cells to protect themselves against HIV. Starting treatment as soon as possible after being diagnosed with HIV and taking treatment that's right for the body keeps CD4 cells armed against HIV and able to protect the body from serious, life-threatening illnesses. It is important to take treatment regularly to help your CD4 cells continue to fight off HIV. Effective treatment taken correctly means that people with HIV can lead full and healthy lives.
Now that we have introduced you to what HIV is, let's see what Dr. B, a medical doctor, has to say.
Hi everyone. So today I'm going to talk about the causes and transmission of AIDS. We all know AIDS is the disease, but the one which causing the disease is HIV virus. This virus will transmit from one person to another person in many ways. For example, let's say an infected person and a normal person have sexual intercourse between them. There is a high chance of the normal person to get the disease. Secondly, if there is a sharing of contaminated needles between them, the virus have higher chance of transmitting from one person to another person. Thirdly, if a mother have AIDS disease, she is not advised to breastfeed her child because the virus easily can pass through the milk and infect the child. So this awareness video is to let know the people that HIV virus is not only transmitted by sexual intercourse and there is many ways too. So if a person infected, they should know their do's and don'ts so that the virus doesn't transmit to another person. And then other people also don't look down at people who is infected with this virus. So that's all. Thank you.
In this episode, we also reached a lady named Loshiny to share with us a story as a person living with HIV.
Hi everyone, I'm Loshiny Dewi, and I was asked a few questions of being a HIV positive patient. So the first question is feelings of living with HIV. I actually had this mixed emotion when I got to know I had HIV. I had this sense of denial. I thought, okay, maybe the test results were wrong, or there was a mix-up of test results. And then I was also angry because I didn't know how I contracted the virus. And I did ask my doctor to enlighten me on some of the ways, and she told me, okay, maybe through needle stick injuries or blood transfusions. And that's when it struck to me, oh, I had an emergency transfusion last year due to my chronic anemia. And I was also sad and depressed because I know it's something incurable. And the second question is do's and don'ts being HIV positive and the treatment. So firstly, I thought I should do something to keep myself busy so that I could divert myself from always thinking about it. And I was also sure that I should prevent myself from doing anything that could transmit my body fluids, because that's how HIV is transmitted. And about the treatment, I went and browsed through net and I found antiretrovirals are used, which is used to actually reduce the viral load in your body. And about how the stigma and discrimination could hinder me from assessing a treatment. I had a hard time because I realized that people out there actually only know that HIV is transmitted to sexual intercourse. They don't really know the ways of how it's actually transmitted. I had difficulty in coping up with people's judgments because people had all kind of thoughts, of how you actually contracted the virus. And I was depressed. I was overthinking every single thing. I forgot to take my medications, and it actually made it worse. I was physically and mentally ill. And then I realized that I actually shouldn't get people's judgment into my head and let their judgments dictate my life, because at that point I should only make myself happy. And the lastly is about the trends of people living with HIV having normal and healthy children. In the future, definitely I won't have children as well, but I was crushed when I got to know I had HIV. And my doctor actually gave me some hope, telling me that people with HIV can also have healthy, normal and HIV-free children. And it's just that they have to be compliant to the medications, which will actually reduce the viral load in your body and decrease the risk of your children contracting the virus. It actually gave me some hope, like, okay, I can actually lead a normal life apart being HIV positive. And if you are a HIV positive patient, just know that it's not the end of your life. Every cloud has a silver lining. You just have to adhere to your doctor's advices and be mentally strong, because when you're mentally strong, the impossible becomes possible. That's all. Thank you.
Next, we also brought you a psychologist to share her take on HIV. Assalamualaikum warahmatullahi wabarakatuh. As a psychologist, it is very important for me to help people improve their mental health. So mental health will include your emotional, psychological and also social well-being. And it is very important as it influences the way we think and also act. So our topic today tells how the people with HIV are being treated badly and discriminated by most of us. So first and foremost, we should bear in mind that everyone has feelings, and it is crucial for us to respect each other despite our differences. HIV patients are often treated badly due to the stigma that having HIV is a disgrace and is socially unacceptable. So in Malaysia, they are viewed as someone who is not supposed to touch or talk to anyone. So little do they know that these people often isolating themselves and they feel worthless due to the fear of prejudices and also negative attitudes of other people. So can you imagine being insulted and judged constantly by the society? I mean, you would feel depressed, right? So it must be hard for us to go through that without feeling depressed. So same goes to these people. So they are worth being treated with dignity too. So it is absurd seeing a person refusing casual contact with a person living with HIV. Therefore, I strongly believe that offering mental health support to them is fundamental. And excellent mental health will help them to live joyously, and also it is essential for them to treat HIV. So depression is a very common mental health condition amongst these people, and the symptoms will include feeling extreme sadness and also feeling helpless. So I strongly suggest that people living with HIV to talk to their healthcare provider if they are experiencing any of these symptoms. So they can also book an appointment with a psychologist that can assist them. So a psychologist can help them to cope with their life struggles with therapies. So I think that they need to be told that it is completely normal to feel sad and they are not always alone. So I mean, we have trained professionals and we have psychologists that can aid them to live like other people do. So in conclusion, we need to realize that everyone's mental health is important. Moving on, we have Ms. Swati, a representative for Malaysia AIDS Foundation, to help us spread awareness on HIV.
Good morning, ladies and gentlemen. My name is Swati Anbalagen and I'm a representative from the Malaysian AIDS Foundation. The Malaysian AIDS Foundation was formed in 1993 to raise and administer funds to support the activities and the programs of the Malaysian AIDS Council and its partner organisation. The Malaysian AIDS Foundation supports the activities of the Malaysian AIDS Council and partner organization across the country to implement projects funded by the Ministry of Health and other funding bodies. This includes providing shelters for people living with HIV, including women and children who have been abandoned by their families, outreach programs for the marginalized communities, and needle and syringe exchange program for injecting drug users. So the objective of the Malaysian AIDS Foundation includes prevent the spread of HIV in Malaysia, increase public awareness and knowledge on HIV issues, protect the rights of people living with HIV who may suffer discrimination due to their HIV status, and support Malaysians living with HIV, including women and children who made vulnerable by AIDS. So what do we do with the donation we raise? We conduct campaigns, events, schemes that help people living with HIV and also raise awareness among the people. So for instance, we conduct a scheme called Pediatric AIDS Fund, PAF in short, which focuses on underprivileged children aged 12 years old and below, born with HIV or born into HIV impacted families. We also conduct a scheme called PAL scheme, which provides free second-line medications for Malaysians living with HIV, giving them an opportunity to undergo antiretroviral treatment with the objective of helping them to prolong and improve the quality of their life. The My Lady Assistance Scheme is a special empowerment program that provides women living with HIV from underprivileged background, giving them an opportunity to help themselves. So if you wish to donate or make changes in these people's life, you can contact us through our website yam.org.my. Thank you.
Hi everyone, welcome back to our TV shows with our topic today, HIV, had the disease, not the disease. I am Surianti, your pharmacist today. As for the role of pharmacists in caring for patients with HIV, pharmacists in fact have many responsibilities in the care of patients with HIV. The most obvious role of a pharmacist is to cater the treatment, as in medication, for patients with HIV. And the management normally includes the use of multiple and antiretroviral drugs to control HIV infections. There are several classes of antiretroviral agents that act on different stages of HIV life cycle. The use of multiple drugs that act on different targets is known as highly active antiretroviral therapy, HAART, or HAART. HAART decreases the patient's total burden of HIV, maintains function of the immune system, and prevents opportunistic infections that often lead to death. HAART also prevents the transmission of HIV between serodiscordant sex and opposite sex partners, so long as the HIV positive partner maintain an undetectable viral load. According to the World Health Organization (WHO), standard antiretroviral therapy (ART) consists of combination of at least 3 antiretroviral (ARV) drugs to maximally suppress the HIV virus and stop the progression of HIV disease. Huge reductions have been seen in rates of death and suffering when use is made of potent ARV regimen, particularly in early stages of the disease. So how does antiretroviral works? HIV attacks the body's immune system. A weak immune system means that the body struggles to fight off illnesses, from infections to cancer. Antiretroviral medications prevent HIV from multiplying, thus protecting the cells that the virus would otherwise target. The less HIV present in a person's body, the easier it will be for the immune system to recover. As I mentioned earlier, treating HIV involves a combination of medications. There are many types of antiretroviral drugs. These are the following different categories of antiretroviral drugs: nucleoside reverse transcriptase inhibitors (NRTI), non-nucleoside reverse transcriptase inhibitors and NRTIs, protease inhibitors, entry inhibitors, and integrase inhibitors. The patient will be prescribed the according drugs that are suitable with their severity of infection according to the treatment guidelines.
guidelines from the HHS recommend that all individuals with HIV begin antiretroviral therapy as soon as possible. This gives people the best chance of reducing their viral load and risk of complications. And yep, I guess that's all from pharmacy side. Do not worry, we can fight this HIV. Stay positive, keep faith, because there is hope for patients with HIV. We can fight this together, break the stigma. Remember to hate the disease, not the disease. Thank you. Goodbye.
Lastly, we managed to get a WHO representative to be featured in this video. Let's see what she has to say.
Good day everyone, my name is Yashwini Thanabalan. I'll be sharing some information on epidemiological of HIV. So epidemiologic triangle is used to understand an infectious disease such as HIV, human immunodeficiency virus, more deeper. So this triangle consists of 3 parts: agent, host and environment. So first, agent. HIV is a viral infection that targets the human's immune system, making him or her to be more susceptible to other infection caused by bacteria, virus, fungus and also parasite. So this makes the body to unable to fight against this HIV by its own. So HIV is transmitted through direct contact with an infected person's bodily fluids. This is through sexual contact, sharing needles and even mother-to-child transmission during childbirth. So secondly, host. Scientists had made a theory that HIV was originally carried by chimpanzees. So in the olden days, humans used to hunt for chimpanzees' meat. So when they ate the meat, they got infected by mutated form of virus, which was in the chimpanzee's blood. So that's how human got infected by HIV. So thirdly is environment. There are a number of socio-economic factors that impact the spread of HIV within a community. So studies have proved that poverty limits, social pressure, low-income households, those who were unemployed, had less than a high school education, HIV infection was more common in that kind of categories. So there were also countries with low and middle incomes such as Eastern and Southern Africa, Western and Central Europe, and also North America. So I have included some statistics and charts regarding those populations being infected by HIV. So as Malaysians being infected by HIV in 2018, there are several charts that I'm going to share with you guys. So that was a total of 31.5 million of population in our Malaysia in 2018. So about 87,000 people living with HIV and about 41,486 people were on antiretroviral therapy. Okay, and also there were about 2,600 AIDS-related deaths in 2018. About 260 pregnant women living with HIV and more than 95% of HIV-positive pregnant women received WHO recommended regimen for prevention of mother-to-child transmission. So in a nutshell, in 2018, the number of new infection cases increased, people living with HIV increased, the number of deaths related to AIDS decreased. So there were certain charts and statistics that I have included. I hope you will enjoy it. So I will end my information sharing session with a quote said by Mahatma Gandhi: "It is health that is real wealth and not pieces of gold and silver." Thank you.
These are some of the statistics of the people living with HIV. Living with HIV is certainly not easy. Now we all know that HIV is curable. So hate the disease, not the diseased. Thank you for watching. See you guys in our next episode.